The elderly can experience a variety of health issues as they age. However, there are certain signs that may indicate that an elderly person is nearing the end of their life. Being aware of these signs can help loved ones prepare for what lies ahead, allowing them to spend their final moments with dignity and peace. In this video, we will discuss 5 common final year signs in elderly loved ones. If you notice any of these signs in your elderly loved one, please consult with a healthcare professional. They can provide guidance on how to best care for your loved one during this difficult time. No. 1. Inability to eat and drink. As a person approaches the end of their life, their ability to eat and drink may start to decline. This is because the body's digestive system slows down and becomes less efficient at breaking down food and absorbing nutrients. Additionally, changes in hormones and metabolism can make it difficult for the body to process food and fluids. The elderly may also lose their appetite as they approach the end of their lives, which can further contribute to weight loss and malnutrition. It's important to note that not all elderly people will experience this sign, and some may continue to eat and drink normally until shortly before they pass away. However, if an elderly person does begin to have trouble eating and drinking, it's important to seek medical attention. This is because dehydration and malnutrition can lead to other serious complications, such as infections and bed sores. In addition, it's important to ensure that the elderly person is receiving adequate nutrition and hydration, as this can help prolong their life and improve their quality of life. If an elderly person is unable to eat or drink enough on their own, a feeding tube may be necessary to ensure that they are getting the nutrients and fluids they need to stay healthy. No. 2. Changes in sleep patterns. The sleep patterns of the elderly can change significantly as they near the end of their lives. This is due to a variety of factors, including physical discomfort, pain, confusion, and changes in the body's internal clock. In particular, elderly people who are suffering from dementia or other cognitive impairments may experience more significant changes in their sleep patterns. They may become restless at night and wander around the house, or they may become agitated and confused and need assistance with basic tasks such as getting to the bathroom. Furthermore, as an elderly person approaches the end of their life, they may spend more and more time sleeping during the day and become more active at night. This can make it difficult for family members and caregivers to provide the necessary care and attention to the elderly person, but it's important to be patient and understanding during this difficult time. By making some simple adjustments to the environment, such as reducing noise and distractions and providing comfortable bedding and pillows, it's possible to help the elderly person get a better night's sleep. Additionally, caregivers should be aware of the signs of delirium, which can occur when an elderly person is suffering from a high fever, dehydration, or a urinary tract infection. Delirium can cause a sudden change in mental status and may require medical intervention. Overall, it's important to prioritize the comfort and safety of the elderly person with changes in sleep patterns. By making necessary accommodations and seeking medical attention when needed, caregivers can help ensure that the elderly person receives the care and support they need during this difficult time. Number 3. Increased pain. As an elderly person approaches the end of their life, they may experience an increase in pain and discomfort. This can be due to a variety of factors, including the progression of their underlying illness, the weakening of their immune system, and the decline of their overall health. In particular, elderly people with chronic conditions such as cancer, heart disease, or dementia may find that their pain levels increase in their final days or weeks. The pain may be constant or intermittent and can range from mild to severe. Additionally, the elderly person may also experience other symptoms such as fatigue, nausea, loss of appetite, and difficulty sleeping. It's important to note that not all elderly people will experience an increase in pain as they approach the end of their lives. Some may remain relatively pain-free until shortly before they pass away. However, if an elderly person does begin to experience more pain, it's important to seek medical attention. A healthcare provider can assess the situation and determine the underlying cause of the pain. They may adjust the dosage of the medication or try a different medication altogether to help alleviate the pain. In addition, there are also alternative therapies such as acupuncture and massage that may be helpful in reducing pain and improving the quality of life for the elderly person. Ultimately, the goal is to keep the elderly person as comfortable as possible during this difficult time. By working closely with a healthcare team, family members and caregivers can develop a plan to manage the pain and ensure that the elderly person's wishes are respected. No. For withdrawal from social contact. When a person reaches their final year of life, they may begin to withdraw from social contact and isolate themselves from friends and family. This can be due to a variety of factors, including physical limitations, cognitive decline, and changes in their social support network. For example, an elderly person with mobility issues may find it difficult to travel or leave their home, which can lead to social isolation. Additionally, those suffering from dementia may struggle to recognize and interact with loved ones, leading to withdrawal and disconnection. Furthermore, as an elderly person's health declines, they may be less active and less engaged in their community, which can result in a loss of social connections. It's important to remember that each person is unique, and some elderly individuals may choose to withdraw from social contact as a way of coping with their diagnosis or as part of their personal preferences during this time. However, if an elderly person's withdrawal from social contact is causing them distress or impacting their well-being, it's important to seek professional help. A therapist or counselor can provide support and guidance to the elderly person and their loved ones, helping them to navigate the challenges of aging and isolation. In addition, there are also community resources available that can provide social support and activities for the elderly, such as senior centers, adult daycare programs, and volunteer organizations. By utilizing these resources, elderly individuals can maintain their social connections and reduce feelings of isolation and loneliness. No. 5. Unconsciousness. As a person enters their final year of life, they may experience periods of unconsciousness, or what is also known as a coma. This can be due to a variety of factors, including the progression of their underlying illness, the weakening of their immune system, and the decline of their overall health. In particular, elderly people with chronic conditions such as cancer, heart disease, or dementia may find that they spend more time unconscious as they approach the end of their lives. It's important to note that not all elderly people will experience periods of unconsciousness as they age, and some may remain conscious until shortly before they pass away. However, if an elderly person does begin to experience more frequent or extended periods of unconsciousness, it's important to seek medical attention. A healthcare provider can assess the situation and determine the underlying cause of the unconsciousness. They may adjust the dosage of the medication or try a different medication altogether to help alleviate the symptoms. In addition, there are also alternative therapies such as acupuncture and massage that may be helpful in reducing pain and improving the quality of life for the elderly person. Ultimately, the goal is to keep the elderly person as comfortable as possible during this difficult time. By working closely with a healthcare team, family members and caregivers can develop a plan to manage the symptoms and ensure that the elderly person's wishes are respected. Conclusion: recognizing the signs that an elderly loved one may be in their final year of life can be challenging but important. By being aware of the 5 common signs discussed in this video, such as changes in eating and drinking habits, sleep patterns, increased pain, withdrawal from social contact, and periods of unconsciousness, you can better understand what to expect during this difficult time. It's important to remember to remain patient, compassionate, and communicative with your loved one and their care team throughout the journey. By doing so, you can ensure that your loved one's final year is filled with dignity, peace, and comfort. If you found this video helpful, please don't hesitate to share it with others who may benefit from this information. Your support and engagement help spread awareness about these important topics and enable us to continue creating valuable content for our viewers. Thank you for watching, and take care.